Good evening. I'm Mayor Ron Nirenberg, along with Bexar County Judge Nelson Wolff. Tonight we're joined by Dr. Golare Aga, who is our Chief of Informatics at Metro Health. You've seen her here before talking about the data, and this is our COVID-19 update for the San Antonio community. Tonight we're reporting 109 new cases of COVID-19, which brings the total to 45,364 since this pandemic began. Our 7-day moving average is now 148. We do unfortunately have 4 new deaths to report. That brings our total to 725. These deaths occurred between July 7th and to today. And again, please remember to keep these folks and their families in our prayers because these are family members, neighbors, colleagues who we've lost. Tonight in the hospital is reporting 473 people in the hospital, which is down 5 from yesterday. 40 new admissions to the hospitals, 207 total in ICU, and 139 on ventilators. Those numbers are all moving in the right direction, with 59% of our ventilator capacity and 17% of hospital beds available. Our hospital system again remains under high stress. As always, on Mondays, we provide an update on our progress and warning indicators to give you kind of a global picture of what's going on with the pandemic in our community. And so let me go through some of those indicators right now. From the graphic, you can see the 14-day trend in cases is moving steadily downward, and that's a good thing. There was a rebound of cases between August 7th and August 10th, but we need to keep working towards a continuous decline, and I'm happy to say that that is occurring overall. On the case and contact tracing, similar to last week, we currently have the capacity to process 1,400 cases daily as needed. This past week, again, our average daily cases was 143, so we're looking good there. We're continuing to see a gradual decline in hospitalizations, as I mentioned. Our daily ICU and ventilator numbers are also continuing to decrease modestly week by week. Our goal is to reduce the spread of the virus so that daily hospitalizations, ICU visits, ventilator needs, et cetera, continue to go down. And for the 3rd week in a row, daily hospitalizations are on the decline. Our case doubling rate is holding steady in the green zone at 40 days, and that is well above our goal. And some very good news today. The positivity rate of cases declined again, and for the first time in quite some time, we are below 10%. In fact, we are at 9.9% positivity reporting this week. That's good. Remember, though, our goal is to get below 5%, and that's particularly important as we get closer to schools opening. And as I mentioned earlier, there's less stress on our hospital system, but it still remains under high stress. And so our overall risk level in the community is also moving down, and it's moderate this week. Again, we must all do our part to keep it there and keep this trend moving in the right direction. So please mask up and keep physical distance from others. Let me turn it over to Judge Wolff.
Yeah, thanks, Mayor. And when you do look at these weekly reports, it really gives us a better picture of what's happening. When you do the daily ones, it kind of stacks up, and it can vary from day to day, but the weekly ones really begin to show you where we're headed, and we're certainly headed in the right direction, but it also means that we can't let up, and we have to continue to do the things that we're doing. Let me thank Jane Hartman for this scarf. It's a Texas scarf for the 150th anniversary, and I appreciate her doing that. I hope you guys are doing okay out there. You're really making it work, and you need to keep it up. Hope you're getting a little work done around the house. You know, I was reading an article today where everybody was really plowing more money back into their homes, and I think we all like to do some of that. I know we got rid of a barbecue pit so we could put in a treadmill so we could Tracy and get more exercise, and we're planting plants. And anyway, I think that's good and healthy to be outside and doing those sort of things. So keep it up. We will be closing the parks as we approach Labor Day. We'll be closing from 9 p.m. on September the 4th till 9 a.m. on September the 8th, and I think the city will also be moving in that same direction. So we're on a good track, and let's keep it up. And if we continue to do what we're doing, we're going to be able to meet this flu season and hopefully do very well during the flu season, as well as we continue to fight off the COVID.
Great, thank you, Judge. And as a reminder, we knew where we were back in May. Things were moving in the right direction, and we, by and large, let our guard down, and things started to go in the wrong direction. We saw what happened in July and August. So if you're planning ahead, let's make sure we have a safe Labor Day and we can get towards school opening in a safe manner. So again, please, as you're planning, make sure that you know that city parks are closed during Labor Day weekend as well, in accordance with the county's orders as well. I do want to say thank you to Jacob. He's an 11-year-old boy out here in our community, and he's gotten the message and is carrying it as well to his community about how important it is to stay vigilant, continue wearing masks, and physically distance as we get closer to schools opening. It's not a time to let up. And so I want to thank Jacob. He's 11, and he made these custom shirts for the judge and me that say San Antonio Strong, wear your mask. And on the back, it says, do your part, stay 6 feet apart. So thank you very much, Jacob. That's the right message. We've got to remain vigilant. Keep it up, San Antonio. You're doing a great job. Let's protect each other and save lives in our community. As always, you can text COSA.gov to 55000 for the latest text updates, or go to the website at covid19.sanantonio.gov. Dr. Aga, myself, and the judge are available for questions.
Go ahead. With this news of the 10%, what does this mean? Are we heading in that right direction to be able to open in-person classes soon? Or does this mean?
Yeah, it's good news. The positivity rate is a heavily weighted indicator, one of those that we've been bird dogging for a while, and it's been as high as 25% in our community. It's now finally below 10%, but again, we wanted to get it. We need to get it below 5%. So it's moving in the right direction, but it's moving there slowly, and so we've just got to continue to do our part.
We're about 2 weeks away from the first day of school, almost all the school districts in San Antonio. We do know that up in Comel and up in Kendall, they started earlier. We know they had some problems, and we probably will also. But we're learning a lot from them. So I think getting prepared for September the 8th, that gives us 2 more weeks to bring down that infection rate. And I think what we've learned and the hard work all the superintendents and teachers and everybody else is doing, crossing our fingers, and we're looking forward to a successful opening of the schools.
I literally could not have said it better myself. Seriously.
So what would you say it is that we've learned just to keep people home until it's a more safe moment? What did we learn?
We wear masks, especially when we can't socially distance. It likely has a large effect because, again, that mask mandate went in July 2nd, and a few weeks after that, when we see a significant event, we started to head in the right direction. I think we learned our lesson after the last long weekend, and the number of deaths that kept going up, I think were a reality check about the importance of thinking that this virus is not, something to be taken lightly. And I think just all of us getting on the same page consistently with reiterating the messages and meeting outside and not in closed indoor crowded places. Really, that's the key to it, in my opinion.
And I think we've learned that we can control this pandemic. It doesn't have to control us. If we are doing the small things like wearing masks, it can make a big difference. And we see what happens to families when that doesn't happen. I had my colleague, Councilmember Rocha Garcia, on this briefing a couple of days ago or last week, and you see the devastating toll the pandemic has had on communities, on particular families, but we have the power to prevent that from happening to more people.
We have some text questions from Brian Chasnoff at the Express News. At 5 deaths per 10,000 people, Bexar County has more COVID-related deaths per capita than any other major urban county in Texas. Why is this the case, and has Metro Health found any specific reasons for this top ranking?
So yes, in terms of the numbers, I'm happy to speak with Brian. I'd have to see how that 5 deaths per 10,000 that you said is calculated. When we look at the number of deaths that are confirmed today, which is about, I think, 725, if I'm correct, and again, there's a difference between what the state is reporting and what other sources may report versus what we say we have confirmed up till today, this point, and please correct me if I'm wrong. So it really depends on how that number is being calculated, because when I calculated the death rate, it was around 3.61 per 10,000. Now, that being said, when you think about calculating a death rate, it really matters whether you're calculating a crude death rate or an age-adjusted death rate. When you want to compare county to county, an age-adjusted death rate is a very common statistic that is, usually talked about when we're comparing deaths in one place to another. It has to be adjusted for the population distribution, age distribution. So this is actually, Brian's question is a very interesting question. What would better answer that is comparing age-adjusted death rate between county to county, and then also in another way thinking about death rate in specific age groups. Like, let's compare the death rate among those 65 and over when we compare Houston to San Antonio, et cetera. But even if we do see a higher death rate, then it becomes it's a great question that is about what are the risk factors for death, and do we carry a heavier burden? So again, we know age is a risk factor, and we know underlying conditions are a risk factor. So this is something to explore when we're trying to compare one place to another to see whether there's a higher level of underlying conditions in Bexar County versus somewhere else. So those are the answers that I have to a very complex epidemiological question.
I think she said it right. We know we have problems with underlying health. We know a significant portion of our population have diabetes. Yep. We know that we have hypertension. We know we have a problem with obesity, and those are some of the leading indicators of succumbing to this COVID. And I would assume that's.
I'm a chronic disease epidemiologist, and the judge is becoming my favorite fellow chronic disease epidemiologist, I must say.
One more question from Mr. Chesnoff. How many state-reported COVID-related deaths in Bexar County are still disputed by Metro Health?
We have listed 273 deaths that are still under investigation, waiting to be verified.
Dr. Aga, why doesn't the hospital capacity seem to be increasing at the same rate of the decreasing hospitalizations?
Right. So the answer is always complicated when you're looking at a score that involves many different complex variables that are calculated very in a very complex manner. So the hospital system stress, and again, I'm not this expert with STRAC. I have my colleagues who sort of inform me to the best that I can understand. It involves many metrics that are go beyond just percent ventilator available or percent staff beds available. And a large part of that system stress score is also staffing. And the short answer to what you're asking is they are still recovering from all the changes and the things they had to do due to the multiple weeks of surge in COVID. So when it comes to staffing and basically resetting up the units that had been dealing with the surge, ICU readiness and a lot of other measures, they're still experiencing high stress because they're dealing with the aftermath of the several weeks of COVID surge that we have. And again, let's remember, the hospital is seeing patients that are not just COVID patients. It's all sorts of patients. And hopefully, again, as the judge said, with the flu season, we won't, have a lot of problems. But it involves many indicators. And they're still dealing with the aftermath of the surge, especially when it comes to staffing and resetting up the units that they had. And I'll let the mayor answer if he has more than that on that, or if there's anything I'm missing.
I was captivated by the answer. Could you repeat the question?
The question was, why doesn't the hospital capacity seem to be increasing at the same rate of the decreasing hospitalizations?
Oh, I see. Well, again, remember that there's a lot of ways to ease capacity that hospitals are utilizing right now. One of them, again, is at the beginning of this was to suspend elective surgeries. Some of them were to call in nurses and cohorts of nurses from outside jurisdictions to provide some relief. So it's a staffing issue as well. So as hospitalizations go down, they are also calibrating how many beds they might need to staff at that point. And so the good news is there's much less admission related to COVID-19 happening, and the hospitals have the ability to open up new capacity if it's needed.
You know, we know there's some long-term effects of COVID among some people, and I think as of today, we have about 84 that are in assisted care facilities where their level of care is not as demanding as it would be in a hospital. So we watch that number also to see how many people are still having to be in assisted care.
And I'll just also add, we have a briefing with our STRAC team every single day, and just today, Eric Epley, who's the director of STRAC, reminded us just how close to the brink our hospital system got at the peak of the cases in July. I mean, we had people coming in to relieve staff from the DOD. We had them from the state. We were very close to the edge. We don't want to go over the edge. So, you know, being mindful of capacity is even important as we're on the downward trend.
Since we're talking about the state, on another note, Texas is preparing for 2 storms that are gaining strength right now. Are there any shelter hubs in San Antonio for this hurricane that's coming? Or are there any developing plans happening right now?
Yeah, so we went through this with Hurricane Hannah. I believe that was the name of the previous hurricane. At any rate, yes, there is a COVID modified hurricane response plan, evacuation plan in the event there are mandatory or voluntary evacuations. We have cohort facilities ready. We have shelter facilities ready. The thing to keep in mind is that we drill down on these situations that might arise and the contingencies, you know, every week. What's interesting about COVID and a hurricane response that's different than before is obviously sheltering is going to be different. So they are prepared for different kinds of family units, and whether someone needs to be isolated and receive medical assistance at the same time they're being evacuated. So there's a lot of different elements to a COVID hurricane evacuation, but you know, our folks at the EOC are the best in the business.
Well, I think this one is going to hit more along the East Coast rather than South Texas, so hopefully we won't see a lot of damage here, a lot of people coming in here, but when they do come up from South Texas with a hurricane, we do use the Bexar County grounds as sort of the staging grounds. And with COVID facing us, you know, you're not able to jam a bunch of people in a room like we were able to do before. And I would think that it would be necessary probably to book some hotels and stuff to be able to handle people if they do come up. But hopefully we won't be affected by the one that's coming up.
Is there any specific locations already established for people?
We have hotels that we already have at the ready. We have shelter facilities for different kinds of family units. I don't have that in front of me where those are located, unfortunately.
In terms of how the city, I know that the city has decided to close the parks for the weekend, the holiday weekend. Can you talk to us about what that means and why we're doing this again?
Means don't go to the parks over Labor Day. I mean, you can, the trails are open mainly for people to get, you know, some fresh air and fitness, but move. We don't want people congregating, basically. And the importance of that is that we know that that's congregating with folks outside of your household is still the way that this infection will persist.
We saw success with July the 4th compared to the previous holiday we had in May, and so we think that this is important to do too, and it kind of, well, it's right on the September the 8th, we stay open at September the 8th, the school starts, so we didn't want those parks open that might lead to problems starting with the school also.
Thank you.